Hi everyone, I'm Jill Holloway, a registered dietitian. Today I'm walking you through the nutrition care process for Susan, a middle-aged woman of Jewish descent recovering from an acute myocardial infarction and an emergent cardiac catheterization. As Susan transitions to the cardiac care unit, my nutrition assessment will focus on both clinical and cultural needs. Here's what I'll collect: anthropometrics, height, weight, BMI, recent weight trends, biochemical data, lipid panel, fasting, blood glucose, renal function, and electrolyte levels, clinical symptoms, nausea, fatigue, appetite, hydration status, especially since she is currently NPO, dietary recall, including typical intake, sodium and fat sources, and supplement or medication use, cultural dietary preferences. Susan follows a kosher diet, which requires attention to food preparation, food combinations, and sourcing. Medical history, any history of hypertension, hyperlipidemia, or diabetes with guide over intervention plan. Based on her current condition and dietary history, here is a sample nutrition diagnosis: excessive saturated fat and sodium intake related to limited knowledge of heart-healthy dietary practices, as evidenced by elevated LDL cholesterol, hypertension, and dietary recall high in processed and animal-based fats. This diagnosis will help guide our next step, nutrition intervention. For Susan, I'll implement a cardiac nutrition plan that aligns with her medical needs and kosher dietary restrictions. This plan includes sodium reduction, 1,500 to 2,000 milligrams a day to support blood pressure control, saturated fat reductions, 7% of daily calories, replacing with the unsaturated fats like olive oil or avocado oil, increase fiber through whole grains, legumes, fruits, and vegetables to improve lipid profiles. Lean proteins, encouraging kosher certified plant-based proteins and lean meats with skinless poultry and fish. Hydration. Once NPO is lifted, fluid intake should be guided by renal status and catheter protocol. To support cultural competence, I'll ensure that all meal options are kosher certified, and I'll provide patient education materials that are culturally relevant, including label reading tips for kosher foods and substitutions for high sodium transition items. This approach promotes healthy equity, making care both accessible and respectful to her identity and beliefs. I will monitor Susan's progress through the following: follow-up labs, lipid panel, blood pressure and blood glucose levels, intake tracking, monitoring her food preferences and tolerance post-procedure, weight changes and fluid status, patient understanding through brief quizzes and discussion to reinforce education on kosher heart-healthy modifications, interdisciplinary collaboration, communicating with nursing and cardiology teams to ensure goals are consistent across care. In summary, Susan's recovery from a cardiac event requires individualized nutrition care with attention to her clinical needs and cultural values. Through careful assessment, culturally competent education, and outcome monitoring, we can help support her path to a long-term heart health. Thank you.